The federal government announced extensions to certain benefits earlier this week, but COVID-19 survivors who are still recovering from the virus are struggling. And as Manesa Dhanabalan explains, they're calling for financial and medical help.
You don't know every day what you're going to get when you wake up.
Billy Jo Player is a retail worker, and she hasn't returned to work since she contracted COVID-19 in December.
I have days where my legs are so numb, I feel like I can't walk. I have days where I'm so dizzy, I feel like I'm going to pass out. There's been a couple of nights where I've gone into coughing fits so severely that I couldn't breathe.
Player was cleared by public health on December 20th, but she hasn't fully recovered. She's living on medical EI and is worried about what's going to happen when it ends on March 27th.
Even if I am able to go back to work a little bit, I would still need some financial support. And so I'm hoping that I'd be able to go back on EI regular benefits, but I don't know if that's going to be possible or not.
Long haulers are running out on their employment insurance sickness benefits and aren't able to qualify for the extension on the regular benefits because we're sick.
The founder of COVID Long Hauler Support Group Canada, Susie Golding, says they also don't qualify for CRB since they're not searching for a job while recovering.
All of the benefits have been extended. The caregiver's benefit, the CRB, and the sickness benefit have all been extended by the government. The only group that hasn't been looked at are the long haulers.
But financial help isn't the only issue. Player and Golding say long haulers recovering from the virus need more rehabilitation clinics in order to recover and return to work.
So an infrastructure needs to be put in place, networking of clinics that will house like a one-stop shop of an interdisciplinary medical personnel of different specialities that will come together in coordinated efforts to deal with each and every individual.
In terms of bringing a specialized clinic or unit to Hamilton, the mayor feels public health and hospitals are well equipped to deal with the long-term effects of the virus.
But there may be a need down the road in terms of maybe additional resources to help people through. So it's not yet something that our public health has turned its mind to, and I'm not aware that the government, both provincial or federal, has turned their minds to that either.
There are a few post-COVID recovery clinics in Canada, but those are more research-based as opposed to aftercare, which Golding says are much needed. In the meantime, the Long Hauler Support Group have started a petition seeking the help they need.